Hi Joe. So, what's the best way of losing weight? We brought up about low-fat foods and and all of that, but I hear that's changed. What do we need to do to lose weight?
Well, losing weight is very important in the management of diabetes. We know that if you can lose some weight, it can dramatically improve your diabetes control and maybe even reduce some of the medication requirements. But of course, losing weight isn't easy. If it was easy, we wouldn't have a problem with it. But you're quite right. The advice has changed quite a lot over the past year, 2 years really, regarding diets. For many years, we were told we should have a low-fat diet. However, when people tend to eat less fat, they tend to eat more sugar and carbohydrates, and that also is very good at increasing your blood sugar levels, and also is very good at causing you to put on weight. So what we're thinking about these days is more low carbohydrate diets, even if that involves having a little more fat in the diet. So previously, where we've said to avoid things like butter and cheese and eggs, those sorts of foods, we're actually saying that's absolutely fine to have those foods now. Again, in moderation, of course, you're not going to have huge amounts of fat in your diet, but there's no problem in having those foods. Saturated fats, for many years, we're told we must not have them, but the evidence now suggests that saturated fats are probably no worse than polyunsaturated fats, as long as you don't have or any of these fats in too bigger quantities. But what is really important is that we try and reduce the starch or the carbohydrates in our diet. So things like potatoes, bread, rice, pasta, cereals, all of these foods fall into the category of carbohydrates. And when you eat these foods, these carbohydrates are broken down into sugars, therefore blood glucose levels are being elevated. And of course, particularly in diabetes, you don't want to elevate your blood glucose levels, and if you can help it. So reducing the starch content of your diet is very important. We also know these foods are energy foods. They're producing sugars to provide us with energy. And if we're not utilising the energy, we're not burning up the energy, then they will encourage weight gain. So the evidence that it's coming through very strongly now is low carb diets rather than just low fat diets, accompanied by exercise, but diet is by far the most important of the two. If you're thinking about diet and exercise as lifestyle, if you want to lose weight, it's the carbohydrate and calorie reduction that's very, very important.
And what do you think of very low calorie diets, Joe?
Well, there's increasing evidence now for very low calorie diets, and there's work being carried out in Newcastle, which suggests that if you have very low calorie diets down to 600 to 800 calories a day for up to 8 weeks, that from that sort of diet you can lose weight very rapidly. And if that weight loss can be maintained, it can have an enormous impact on diabetes. And certainly their research has shown that people who have been on these diets and have lost as much as 15, 20 kilos can actually reverse the diabetes. So the diabetes may disappear altogether, or they may find they're using much less medication, and possibly even some patients with type 2 diabetes who are taking insulin, with the very low calorie diets and the dramatic weight loss, managing to control the diabetes without the need for insulin injections. However, it's not an easy diet to follow because it is a very, very restrictive calorie diet, very low calorie diets. So certainly if people considering those sorts of diets should really talk to their healthcare professional first to get advice about that. But it certainly is something that can be very, very helpful in managing diabetes.
And where can I go for more information on these types of low carb diets, Joe?
I would certainly speak to your healthcare professional, whether that's your GP, your diabetes nurse, practice nurses. We have dietitians we can refer you to for that advice. But also there's things online as well. There are some useful information there online. It tells you more about these diets. But I would suggest always checking first that it's safe to do these diets before going ahead with it.
Thank you.